I remember having had a grad student from Cameroon, and he had to arrive in Cape Town, and he didn't arrive on the day that we had agreed, and he had a fully paid scholarship, and I was not happy. Why is this person not contacting me? Does he not appreciate the gift we are giving? Does he not even have just tell me that something is going on? I then embarrassingly discovered that he had to walk 5 kilometers to get to the internet cafe in order to check the correspondence from me. And so what I'm getting at is
All right, welcome everyone to the Bioinformatics Lab podcast. I'm Kevin Libwood from PHA4GE, and today we are joined by Alan Christoffels, the principal investigator for the Public Health Alliance for Genomic Epidemiology. Welcome, Alan.
Thanks, Kevin. Good to be here.
Yeah, absolutely. And today we really want to kind of focus the topic on PHA4GE, this global consortium that I've been a part of, you and I have been working on here for the past couple of years. And in previous episodes on the Bioinformatics Lab podcast, we've highlighted different projects I've been a part of, that Andrew Page has been a part of, some of the works in conferences even that we've been able to attend with PHA4GE. But today I really want to focus in and get more about this story, especially from your perspective in how you've, from the beginnings to the challenges today to the future directions and everything between there. But maybe before we start, it might be helpful to even get a little bit of perspective on your background and how you even describe yourself as, you're, as a scientist, as a director of a program, leading these international consortiums. Let's start there, Alan. How do you describe exactly what it is you do in this world of public health pathogen genomics?
Yeah, so there is, as you know, with all academics, there is a day job and then there is another job. So the job that pays my academic salary, I have an academic appointment at the University of the Western Cape. Within that, following similar guidelines to what is happening globally, I have graduate students. I focus on developing methods in pathogen genomics. And that journey really has probably come full circle in exploring a couple of projects as I did some postdoc work abroad, coming back into South Africa, establishing my own group, and then with my luck, having catapulted into the position of heading up an institute. And so juggling getting your own research program running, as well as managing a research center. So that has had its fair challenges, but it's certainly been an opportunity of growth. And through this, having built up international partners, one of the key partners that I sought out back in 2016 to 2017, really, has been the Africa Center for Disease Control and Prevention at the initial stages of when they got established. And some of the informal work that we've been doing with them has sort of grown across the years. But yes, that's where I find myself.
That's fantastic, and it's kind of interesting, even in prepping for this podcast, looking at your background, it's so diverse. But I think there's been an obvious through line in your work of this, maybe I'd call it a global community building, right? From the early on, right, right in your postdoc, you talked about going abroad. I think you spent some time over there in Singapore, not only for the postdoc, but even setting up a laboratory over there. And then, now you find yourself in PHA4GE and being a part of both Africa CDC, but also this larger global multinational programs, and something that you've had a track record in. I saw that you helped to establish that was it the vector-borne Glossina functional genomic network, also multinational organization. So
Yeah.
I wonder if we can even start there. How did that perspective of this global citizen, global community building start in your scientific career?
I think the one thing that I discovered when I started out as a grad student, and incidentally, my first venture onto a plane was when I was doing my grad studies, and so having been exposed to collaborators abroad, what I soon realized is that some of the limitations that we have locally in the projects we're doing calls for us to step up and in some ways become a jack of all trades, because you need to at times probably acquire knowledge on the fly. You have to close a gap where it's not. And certainly in the early days, back in the mid 90s or late 90s, there wasn't the kind of critical mass that one had access to in order to either think through or to critically assess an approach we're taking. And because of that, you just jumped in and tried it. If it failed, well, you try it again. And so that has certainly helped. And I think for me, the benefit has been we were a very small community at the time in South Africa. So that certainly afforded me the opportunities which might not be available to folks that were my peers. And that allowed me to step up and try and be involved in a couple of projects, probably beyond what I've been doing, and clearly wanting to see the kind of development of bioinformatics extend beyond our borders. And that was really the driving force.
And I think that speaks to maybe even the origins of phage. Like at that time, I think that, back in the discussion of 2018, 2017, when the discussion of
Mm.
seeing the utility of sequencing and bioinformatics became so obvious for public health. But I think exactly what you're alluding to, in a lot of areas and communities, the resources weren't there, but it was happening outside of those borders. So there's this obvious need of how do we connect these laboratories across these international communities. So can you maybe take us back to that time, 2017, 2018, at the origins of phage,
Yeah.
and what was the conversations like that led to the creation of this incredible organization that we're all part of now?
Yes, I think, if I look back to certainly a conversation in email between Duncan McCannell and myself back in 2018, late 2018, I think what was clear was internationally there was a number of initiatives underway and really trying to assess what is what is the likelihood, and if so, what would be required for us to ensure that next generation sequencing and also pathogen genomics start to influence public health decision making. And so it was interesting that at that time, the Africa CDC was was busy with a landscape analysis, and that was headed by a colleague who has left since, Philip Onyebujo. And I was essentially working alongside him together with a few folks to really look at where does the NGS capability reside on the African continent. So we're talking 2018. And then together with that, doing far too many travels to various countries to really get a sense of what people mean when they say they have NGS capability. And as you and I both know, that is accompanied, be it with infrastructure, with technical know-how, with support along the side. And so that's what we were doing. At the same time, what I wasn't aware of was that Duncan, together with Trevor Bedford at Fred Hutch, together with the Gates Foundation, has been doing a landscape analysis in the US as well, and essentially also contextualizing the same problem as to how do we get pathogen genomics into public health. Um, and so you had really these projects that were underway. And I think if one were looking at what's happening in Europe as well at the time, I think the scientists were all engaged either at a macro level or maybe a bit more micro, to really understand exactly what is it that we are doing and how do we best probably bring things together. And with that, I was then invited to come to a meeting in March 2019 that was going to be hosted at the Bill and Melinda Gates Foundation offices in Seattle. And essentially, that venue and that meeting was really a collection of bioinformatics and public health experts to talk through what is it that we need that's lacking, and if one can articulate that in the context of public health, what do we need to do or structure mechanistically in order to operationalize the introduction of pathogen genomics into public health. And that was an exciting meeting, and that's where I think I certainly met a lot of our current active members in PHA4GE. And for me, I think that was important. What it opened up my eyes to with some other international projects like the microbial identifier project that is run out of Canada. We've seen work done in the food pathogen space, PulseNet, for example. And so that really highlighted that there are many projects globally, but how do we conceive of an entity or an ecosystem that is able to galvanize all this work and really push it forward?
I love that background story. It aligns so much where, my perspective was at that time. And understanding the different layers of perspectives and
Mm,
scope of, horizons. Because in 2016, 2017, I was at the Virginia State Public Health Laboratory, and we were setting up our bioinformatics for the first time. So I got to actually be a part of that landscape analysis that you were talking about with Duncan
mm,
McCannell and Trevor Bedford, in that I was interfacing with Ali Black, who was at that
yeah,
time Trevor's graduate student, doing those interviews around, and that was pretty domestically focused. So you see how, like, a lot of those common challenges were persisting in the U.S., but that's kind of where my narrow scope of the perspective was.
mm,
What's happening in Virginia? What's happening in Minnesota? What's happening in Colorado? And it's like, okay, we're finding these common challenges. We should be finding common solutions. But then when I got introduced to phage and the conversations you were having with Duncan, it's, wait a minute, a lot of these challenges are echoing way beyond Minnesota, Virginia, but also in South Africa, Southeast Asia, Europe, South
yeah.
America. You're seeing these commonalities of what's impeding the implementation of such a powerful technology. So it sounds like that's where things kicked off. And yeah.
I think absolutely, and if I just think back now, when I started working with the Africa CDC, I think it was only then that I fully appreciated and understood the environment and the governance processes by which folks in the public health space have to operate. And especially if you come from the perspective of academia, where I think somewhat we probably have a bit more freedom in how we do things. Um, Not necessarily the correct way at times, but I think that for me opened up the door to really think through if we are to impact public health with bioinformatics, there are going to be certain fundamentals that we are going to have to adhere to, like, you know, having reproducible software, stuff that needs to be accredited, so that when you're going into a clinical space, the rules and permissions are very much different from a project that is purely run by a grad student or a master's student, for which all I need to do is demonstrate that the student has produced something novel and has published something. Whereas in the context of translating work into public health decision making, we really need to make sure that we're dealing with robust methodologies and ones that are also reproducible. And I suppose that people can take up more easily. This is one thing to develop something. If it's a bit of a pain and a headache to utilize, I think we soon realize that that's not going to go anywhere.
Exactly. And that's been the challenge really of the past decade in public health, bioinformatics, and sequencing, is taking what was established and identified and known and discovered in academia and then streamlining it to a production level for public health. Because academia is not built for that. Academia is built on breaking the standards, pushing things forward, discovering all the new nuances of this new tech. But once those discoveries are made, the challenge we've taken on is the implementation. How do we standardize? How do we put best practices around that? So we know that there's a reproducibility not only within one lab, but what's happening in one country should be really the same thing happening in the next, because these pathogens know no borders, and we need to make sure that these infrastructures are maintained across. So it sounds like from that onset, that was the vision you had for SARS, or rather for phage. But I was going to mention that it was timely, right? Because in 2018, 2019, it's like, hey, we need this consortium because pathogen genomics is going to be so powerful. We need to make sure we're all communicating across borders. 2019, late 2019 it happened, 2020, SARS-CoV-2. Can you talk a little bit about the impact phage had in SARS-CoV-2 response? Because it really was incredible.
Yes, I think that you've mentioned a number of players there. Ali Black, Emma Griffiths. We talk about Finlay Maguire, um, Duncan, and others. And around about mid to late 2019, we were pushed really by the funders to formulate a concept note to articulate how we perceive the following 2 years could be, and setting some midterm goals and more longer term goals. And then funding that was essentially shaped around that in order to support the establishment of PHA4GE. And I can recall email conversations and phone calls with Duncan, and with a concept note that was really one, establishing this consortium, and how do we onboard a number of folks that have really been actively engaged in this space already, but also recognizing the need to not neglect stakeholders from low and middle income countries. And so we were drafting this proposal. And so the decision was that the Secretariat for PHA4GE would be based in a low and middle income country, considered a few places. Then the decision was taken to host it at my university. And I think, yeah, got catapulted into that role to shepherd what was really the initial starting point of PHA4GE. But I think to the credit of everybody that was involved, we hadn't started from a blank slate. There was momentum that has been gained in a number of countries, and key role players essentially came together to try and formulate something that actually had a common vision. And so we had this plan, a 2-year plan, 3-year plan. We launched PHA4GE, in fact, at the African Union in October of 2019. A lot of fanfare. And then came 2020. SARS-CoV-2 and the COVID pandemic arrived, and immediately the working groups that we conceived of at the time, people were then moving around trying to adjust their plans. How do we now respond to this new crisis? And I think that pain points were actually felt globally. And so it wasn't that we have to think through how do we respond as a consortium. In fact, your workplace was trying to respond to this crisis. So I think it was a matter of trying to really merge or trying to align what was happening within various local contexts and using our international footprint as a way of exchanging of ideas and working on common solutions. And I think that really has been the driving force. And it was cost a lot of time on many people, but I think we've seen the fruits of that through the last 2 or 3 years.
Absolutely. It must have been wild to have this idea and vision of a program, put it together, and then it immediately get thrown into the deep end. All right, let's see how this thing works. Let's see if this really does create fruit here. And it really did. It bore fruit. Like, I remember in those early 2020, I was involved in the Bioinformatics Pipeline and Viz working group, and our immediate discussion was like, what are you doing for SARS-CoV-2? How are you guys doing consensus assembly? What are we doing? Richard Neer was on the group from the NextClade consortium there, or Next Strain, and he was always giving insight into how clade designation was happening. And it was such a source of collaborative ideas of exchange. We then, in line with also the working group that Emma Griffith and Finn McGuire lead, they put this guidance document on how to share the appropriate metadata that became adopted worldwide. So there was that vision come to fruition of let's create standards and best practices. And I know our working group was very much inspired by what Emma was doing, and we wanted to do something similar. Hey, let's make sure we get a guidance document. What are we an expert at? And it was this table of people who we all had experience on addressing SARS-CoV-2. We were a part of the very niche techno communities that figured out the best practices, and then our effort was just let's write this down. Let's write this down so that no one has to continue rediscovering this. It
Yes.
puts a rung on the ladder, and then we were able to put that out, and there was a lot of laboratories that
Yeah.
found that valuable.
Yeah. Two examples that come to mind. It was around about that time that the African Pathogen Genomics Initiative program got launched through the Africa CDC with support from the Illumina Company and the Bill and Melinda Gates Foundation. And it was really rolling out laboratory resources. And at that time, there wasn't really time to upskill people. So you had this releasing of equipment and having to follow that up with certain technical expertise. Um, and so through a period of 2 years, I was then asked by the Africa CDC to to lead a stakeholder engagement in Central Africa. And a number of countries came to Ghana, and they were sitting there and people were reporting on their progress. And one person got up and presented, and we heard about all the variants that were identified. And then I saw a phage logo. And somebody from the Gambia then says, and we've really enjoyed using the phage metadata standard. Um, and, and then you really start to realize that once you have a community that is adopting an intervention or technology within a public health setting, I think then we really have met our goal of trying to influence how this field is growing.
Absolutely, because that is the goal, the adoption of the products being produced by this consortium of practitioners. And
Yeah.
it's hard because sometimes it's difficult, even especially because we have a bit of an academic background in a lot of us of feeling that confidence of saying, hey, this is the best practice. So there's a bit of apprehension of wanting to set that line in the sand. But then whenever you see this in work again from the data standards group, you see the utility in it. And you see also the humbleness of the crowd and the community of like, thank you. There's a gratitude. Someone wrote it down to give us a starting point to start the discussion. And then it sort of emboldens others to like, yes, okay, let's write this down. Again, I can't emphasize how much we were inspired by the data structures working group and the way in which they kind of pierced the veil of like, hey, this is what phage can do to the international community in terms of bringing value of all the knowledge we have in our working group. Let's write something down. And that's the same footsteps we were following to contribute to the community.
I think, if I just think of the working group that you and Jamie Southgate was leading, there were protocols that were put in place that became very useful to folks as they started to think around what does this world look like now post COVID-19? Because in various contexts, they are locally relevant diseases. They are priority pathogens that people are working with. And so having access to the kind of guidance documents that has been built up by the pipeline and visualization working group that both you and Jamie had been spearheading, I think really has provided the opportunity for laboratories to really leapfrog and then work from there. And so I think that in that sense, we've really seen the escalation of the adoption of these tools. And I think it's something that, looking back, I don't think we have necessarily carefully monitored that. And so as we reflect on this, is to think through, so to what extent are we capturing enough tangible results to demonstrate the value? Because one thing to claim that we have a value add, but is our value proposition demonstrated? And I think that is something that we are thinking through very carefully as phage evolves moving forward.
And it's a difficult idea to quantify, what the success of the network is. On my perspective, there's so many different variables I can point to, one of which is even just having a global network of practitioners. Our working group now has over 100 practitioners that represent, every continent. And that alone is an amazing metric to look at. Hey, this is something successful, that I can communicate with somebody across Europe, across Africa, across Southeast Asia. I know some of the leading experts on TB in Canada because of PHA4GE alone. And then another funny kind of index is watching the adoption, seeing the PHA4GE logo on presentations, and it's like, oh wow, wait a minute, there's obvious impact here. But how you quantify that and maybe justify that for funding and sustaining, that's a difficult
And I think
that's a
that,
difficult
and I
one.
think, and I think those metrics, just to even pick up on the example that you've mentioned, this network, or what people, I think we abuse the phrase community of practice, but what that actually does at one level is it, in fact, is a confidence builder. And one thing that I've certainly seen in the spaces that I operate is the reticence of individuals to get involved because there is the perception that I'm just not great enough to actually contribute to. I mean, these guys are international folks. My word, the Kevins of the world, the Emma Griffiths of the world, the Trevors of the world. How do I contribute from my space? And I think that these networks affords us the opportunity to really break those barriers, to really start to engage with people and start to see that one could, in fact, share a common vision around a topic of how do we improve public health practices. And so for me, I'm looking at that also as one way in which one way in which we can certainly show the value as demonstrated through PHA4GE, and that is really to build people. And I think that needs to be part of our plan, because that would then lead to growing the community. It also moves us away from a centralized approach that things has to happen in one location, and we can start to see much more impact in communities where these solutions are needed most.
I couldn't agree more. And, again, like I said for the top of the conversation, the work that you've done, especially in the 90s, thinking about an international community building, that's really inspiring to so many scientists. You talked about, not seeing the inside of a plane until you were a grad student, and that's still so true for so many students, and I think we can even maybe touch on the conference, right? And supporting so many students to attend that conference. And I had that chance to meet these earlier career scientists who were traveling for the first time out to the incredible area of Stellenbosch. And we were able to, break bread and commune and talk about science together in person. And I wasn't myself or Emma or even yourself. We weren't some intimidating people on the stage. We were ground level, speaking to these scientists, showing them what's possible, and building that international community.
Absolutely. And I think that for me, one actually realizes just the value of being able to provide that kind of exposure to people. And I think that we will not fully understand or, in fact, appreciate what that event and experience unlocks for folks. And I think the repercussions goes to career possibilities, personal, professional growth, um, and also to understand various places and how things are operating. And sometimes we have a naive view that things are working great at this location, but if I can just be here, that will actually be perfect. But I think we all know that we are all grappling with very similar problems and challenges. And for me, you mentioned the early 1990s, all the work that I did in some of the global partnerships. I think what that has taught me was that one, our perceptions of where or what the needs are not necessarily correct. And I remember the tropical disease research program of the World Health Organization funded us to establish a tsetse fly program, and that was really taking the genomics of the tsetse fly into more functional space. And I remember traveling to a little town called Tanga, which is off the coast of Tanzania, and flew there with a 7-seater or something plane, which was horrifying enough. But landing there, and the idea was we have actually funded a couple of grad students, and it was really to see to what extent is our funding providing the necessary wherewithal in order to deliver on this project. And as I arrive in the laboratory, I trip and I fall over a car battery. And the car battery is keeping the refrigerator running. And when myself and my colleagues had formulated the funding proposal to support these grad students, a car battery was never one of the things that I thought about. We thought about fees for the grad studies, some running expenses to do the experiments. You need reagents, which is a headache in itself to obtain, and then some living expenses. But for the life of me, a battery that sits on the floor. And for me, that was an eye opener that our perceptions of how we think a problem needs to be solved is not necessarily the correct one unless we fully appreciate the context into which we will be working. And that was a big learning curve for me back in the mid 90s. Yeah.
I love that. I think that perfectly portrays, yeah, that the expectation versus reality. You know, you can only get so much from maybe what's published in manuscripts and discussed in white papers and things like that. But when you're on the ground floor, you're going to see something different. Especially, you know, I think there's a tendency in, especially in academia, and less so in public health, because this is a challenge we're addressing straight on, where you might see a lot of the conversations being reserved for high resource nations. And it's like, hey, we have the top bioinformatics scientists, we have the top infrastructure. They only speak amongst each other. But again, as you said, the intent of PHA4GE is to break those barriers and ensure that there is involvement of the entire global community, because public health is a global challenge. So can you speak to that? What have those challenges looked like in terms of ensuring that there's onboarding of both high income, low income countries, middle income, and everyone has a seat at the table to make sure that these ideas are being spread appropriately?
That is difficult. So the big challenge was, how do you in fact bring people on board, um, and even at the spread of what of the members of PHA4GE, and we are excitedly already approaching 400 members. And if you look at that spread, we still have a dominance of high income countries, um, and one has to constantly figure out what is the barrier to entry. Um, and when speaking to folks, some of it has been around our funding model in how we deal with our projects, not necessarily attractive to researchers. And so that becomes a bit of a headache. A lot of projects that we do, and I think you have experienced something similar. We have projects that we do that are well funded. We then have projects that we do which is actually just not funded. Um, and those we put in some time at some point in the 29-hour days that we all have. Um, but for many researchers and public health staff, that that freedom and that flexibility is not there. And so when people are coming to the office, there is a demarcated mandate of what needs to be done, and all resources are channeled there. And so when you are done, you might be going home to a place without resources. You might have to rely on your work for the only internet you have. I remember having had a grad student from Cameroon, and he had to arrive in Cape Town, and he didn't arrive on the day that we had agreed, and he had a fully paid scholarship, and I was not happy. Why is this person not contacting me? Does he not appreciate the gift we are giving, does he not even have the, just tell me that something is going on? I then embarrassingly discovered that he had to walk 5 kilometers to get to the internet cafe in order to check the correspondence from me. And so what I'm getting at is, as one attempts to onboard members to PHA4GE, I think it's to be aware that we need to provide the spaces where people can contribute to various degrees. And we might find that some folks will log in, listen to a working group, and we might think, but is this person not wanting to get involved? And I think the absence of involvement there might not necessarily be what we assume at face value to be complete disinterest. But people are trying to navigate and find exactly how they could best contribute in a meaningful way. And so for me, that has really been the challenge up until now, is how do we, in fact, onboard folks from a range of geographical environments. And I think one way that some of this might happen is through some of the regional activities. We know, for example, that researchers in Southeast Asia, for example, they have different networks that they, in fact, operate in. And is it possible for us as a global alliance to create strategic projects with them so that there is a demonstration of some value that both groups bring to the table? Similarly, what we have in Africa, some of the networks that we have, how do we influence their involvement in PHA4GE moving forward? And we're even starting to talk about this in Latin America. So I think as we look at extending the membership and the contribution from a global array of stakeholders, I think we have to be sensitive to the fact that we might have to provide a value proposition that might have to be very creative as to how we best position that. And one of the ways would be to look at creative funding models for that. And then others would be for opportunities in which people can engage on a professional level in the absence of a financial incentive.
That's an important problem to get articulated out there. And I can speak as a previous chair of a working group. That wasn't always top of mind in terms of how, maybe the resources, the needing to walk to an internet cafe to be able to participate. So in my mind, I was in the more naive state that you described of like, why isn't this person speaking? What's going on there? And I assumed that to be, disinterest, maybe apathy for what was happening. I'm thinking, why are they joining here? But maybe that it's important to hear that. Wait a minute, maybe there's something else going on that end, and there's a challenge. They don't have a microphone on their end. All these other things that you're alluding to, where maybe the challenge is for the chairs to ensure that, and not only the chairs, I would say even me as a working group member now, to ensure that there's an increased interface in multiple points of access to the projects we're doing. It's not just during the meeting call when we're all on Zoom, but maybe there's a Google Doc that we can all add to asynchronously just to get feedback. Maybe even just something as simple as a form and a survey for the working group, because they may not realize, as you said, like their perspective is so powerful. Whatever level of input they're able to add is so critical to the documents, because you don't want it only driven by the perspective of a few. You want these documents to be driven by the perspective of the community. So I think that's an important thing for us to articulate, that to keep it top of mind of how do we increase those access points for people all over the world to really contribute.
You know what I'm realizing now, that the narrative in the scientific discourse is often one of low middle income countries, high and versus the high income countries as a financial differentiator. But what I'm finding is that public health laboratories is an excellent level playing field, because the challenges in public health laboratories in the South is often the same in the north as well. The difficulty to maintain the technical capability of maintaining your software, having the wherewithal to ensure that all the processes are in place, that is not peculiar to one area. And so I think we actually find ourselves in a space where, as we think through solutions to onboard national public health laboratories, we're probably going to find that our solutions could potentially straddle across multiple sectors or multiple countries that is not necessarily governed by the perceived high and middle income stratification.
I think you're absolutely right. This is a challenge we're all facing, no matter where we're at. There's something that, again, going back to the top of the conversation, Ali Black was identifying the through lines of these challenges in the U.S. with her project with Trevor Bedford and Duncan McCannell, and that's why this all has resonated with so many scientists in the community, and I think that's why we see the appreciation of the works in phage, not to just give ourselves a pat on the back, but I think that's why we've gotten somewhat of a warm reception in the field, because it's addressing such common challenges that we all know very intimately that need to be addressed here. So I think we could certainly be speaking about phage on and on for hours, and there's so many topics we haven't even spoken about, so maybe this is first of many. But maybe before we wrap up today, Alan, if you could speak on how can people get involved? Who's the invitation to when we're speaking about, hey, you know what, you should consider joining phage? Who do you care to reach, and maybe even this podcast alone?
Yeah, and I think maybe I'd start off by saying that as professionals, we are probably exhausted by all the networks that we are a part of. We have multiple consortia that we belong to. We have networks of yet more networks. And so being aware of the spaces that we are in, I think as phage, we are really trying to build a community that can position best practices as not only as a de facto has to be done like this, but I think our responsibility that we take very seriously is to put into the scientific community a conceptual paper, a discussion document, a proposed strategy for which we are looking to get critical engagement as an opportunity to refine and also improve on the way to becoming a standard. And so certainly what I would like to see, I think we like to see the spectrum. I think we need more and more folks in public health. I think it's one thing to be focused on the technical know-how of carrying out your bioinformatics analyses and the development of tools and methods. But I think having the perspective of the application scientist, of the person that has to utilize these methods with the task of taking that output and presenting that to public health officials. I think we need that perspective in order to ensure that what gets developed remains uppermost in our mind with a view to understand what the final outcome should be. And then I think we have more and more the need for technical expertise. The difficulty in a volunteer organization such as phage, that you very easily can have burnout. And so you would have folks that would contribute extensively. And I think as we start to onboard people is to recognize that, if you are somebody that is listening to this podcast and you think, but I really don't have that high level of computational expertise, that doesn't matter. I think that we have all seen through our grad studies that learning happens best when it's practiced. And so if you're listening to this podcast and you're wanting to get involved, look at the phage website, contact somebody that you might know that's part of it. Reach out to us, and there'll be links, I'm sure, to the various channels that we can share with you. And then find a space to be involved. And I think there is so much that needs to be done. There is definitely space for everybody to carve out an area where they're wanting to work. And even today's secretariat meeting. And so I must do a shout out to the secretariat team. And they meet every second day, actually. But what we have noted was the importance of reminding participants that the co-chairs of a working group are not there to take over your ideas. They are not there to become the driver of your project. If you have an idea, you want to run with it, you have a forum, you have a community with which you can engage to shape it, to improve it, maybe to try and change things. And I think that if we see our role as contributing to this ecosystem, I think that becomes an important part, because that is really what will drive us forward.
Absolutely. Very well said. And for sure, we can make sure we include the links and resources for everyone to learn as much as they care to about phage. So, Alan, thank you for this fantastic conversation. Thank you sincerely for leading this program. It's really hard to imagine someone with a stronger perspective, leading phage into the activities that we have so far. And also, thank you personally for being a mentor in my career throughout the years we've known each other, and continuing to do what you're doing, hopping on this, continuing your education throughout your sabbatical, throwing a master's degree on top of that. So thanks for everything. And yeah, we'll see everyone in the next one here.
It was great chatting. You take care. Bye.